Yeah. Still, we don't see your slides.
Oh.
Yeah, it's in buffer. Yeah, and make it as a slideshow. I guess, are you using hotspot from your mobile phone? Because sometimes it has a good internet connection and sometimes it's not.
Yeah, because of the poor internet connection, it is showing a lower resolution. That's why
Okay. Mm, okay. So maybe.
I continue same, and we can share the PPT to the people. They can able to, because
Okay.
content is
Maybe what you can do, can you share the slides in WhatsApp? I'll try to share it from my side.
okay. Okay,
Uh,
that's fine.
Open the web WhatsApp and just track your PDF and put it into WhatsApp, and I will share it from here. Hello participants, kindly wait for a few more minutes since we have a technical issue from the speaker side. We'll start in like 3 minutes time.
Dr. Mahesh,
Yeah, I
I
didn't
have
get
shared
any
the
PDF.
PPT.
Okay.
Okay, it is loading
Okay.
due to poor net connection.
Still I'm waiting. Is it uploaded? And can you stop sharing your slide?
Okay.
I guess that take some network bandwidth. So so you already uploaded the PDF?
Yeah, I have already uploaded. Still, it's
Okay.
net connection is very poor due to the climate changes, because it was heavy rain since morning.
Okay. Understood.
Poor net connection. It's loading.
Possible, can you share it on the Telegram? Maybe.
Sharing through Gmail.
Okay. Okay. It will be better if you can share the PDF.
Better if you can share.
I guess you shared the PPT. It may take long time. It would be nice if you can share the PDF.
And sorry for that. Their net connection is very poor.
That's not an issue.
Is it possible to choose how?
Uh, okay, I believe that you changed something. So is that fine?
Yeah, that's fine. I can explain by myself by seeing the PDF.
Okay, then I'll do it from my side. Give me a second. Hello, Miss Abhinaya. I have shared some PDF in WhatsApp. Can you download and share it from your side?
One second.
Yeah.
One second.
Okay. So which one do you PDF or PPT? I got the PPT also.
What also? Okay, and go with the PPT.
Okay.
Doctor,
Yeah.
to change the date, it is showing us October 31st. Is it fine or we need to change?
That's fine. That's fine. Hello, Abhinaya. Kindly check your inbox, email inbox. And I don't know why we don't see any option for you as a make presenter. Like we don't have option for you as a presenter for Muthukumar,
Okay.
but that's not problem. We'll manage it. Okay. And Mr. Muthukumar, always check the mute option. If you are muted,
Okay.
kindly unmute while speaking, okay? Because since you are not a presenter, sometimes I do mute all option that will mute you. So always check the mic button on your panel. If it is red color,
Oh,
make it as unmute, okay?
okay, sure.
Okay. Hello, Abhinay, is that fine? Are you able to download the PDF or PPT? I forwarded the PPT, so
Yeah, I downloaded it and
yeah. Miss Abhinay, while speaking, please keep your mic close to you because sometimes you don't hear your voice.
yeah, sure.
Mr. Muthukumar, I guess we have some background noise from your side. So yeah, now it is fine.
Content, right?
Yeah, share screen. Yeah, yeah, it's in
But
buffer.
and control too.
Yeah,
Uh,
I guess he can tell you like change the slide. So Mr. Muthukumar, kindly every time say that change the slide, okay? So that they can change the slide. And you are muted, kindly unmute.
Yeah, I have unmuted.
Yeah.
no?
Yeah, it's fine now. Yeah, it is fine. So we can start the session now. So we'll give a short introduction. Then Mr. Muthukumar will give a talk. Okay. Then followed by a talk, we will have a question answer session.
Sure.
Is that fine? Yeah. So very good evening, everyone. This is Dr. Mahesh Velusamy here from the team of LLB-School. And first of all, sincere apologize for the network issue and for the technical errors. I'm sorry for the delay. And I welcome everyone on behalf of LLB-School for the final session of our Career Talk webinar series. And today we'll be having Mr. Muthukumar Velusamy, who has 99 years experience in medical coding and auditor, will give an outlook beyond the health information management field and allied sectors. And so without wasting time, I request Ms. Nichita to give brief introduction about Mr. Velusamy. So Ms. Nichita, kindly unmute yourself and give an introduction.
Yes, sir. Good evening or good afternoon to everyone. I am pleased to introduce our guest speaker for today's event, Mr. Muthukumar Velusamy, co-founder of LLB-School and team head of LLB Health Information Management. He had done his DMLT in All India Medical Laboratory Technologists Association in New Delhi and received his master's degree in biotechnology at University of Madras and a certified professional coder from American Academy of Professional Coders. And Mr. Muthukumar Velusamy sir has an experience over 9 years in healthcare disciplines, and he operated as a senior medical coder in many organizations and hospitals like Episos Private Limited, Omega Healthcare Solutions, NMC Royal Hospitals, Saudi German Hospital Groups UAE, and many more. Now he was with us to share his journey in our International Career Talk webinar series and to give a talk on various job opportunities in healthcare information management field for life science, medical, and paramedical students and professionals.
So thank you so much, Nichita, for the wonderful introduction. And now I give a small announcement, then we'll continue with the webinar session. So Ms. Abhinaya, can you change the slide? The next slide. Directly go to the technical announcement. Yeah, the next slide. Yeah, since we don't have a time, we'll give us some technical notes. So the people who are in web, no, the previous slide. Yeah, so here we have some important technical. Ms. Abhinaya, kindly keep the slide number 4. Slide number 4. Hello, Ms. Abhinaya. Yeah, please stay on this slide. Yeah. So we have some technical notes for everyone. The people who are in the WebEx, kindly turn off your webcam and also mute your microphone and try to note down all your questions which will be addressed in the question and answer session. And people who are in the YouTube, kindly subscribe our YouTube channel to confirm your presence. And as mentioned before, we shared the feedback link already in the our Telegram group, and also in the flyer. So please note down the feedback link, and the feedback link will start at 7:30 p.m. So this time we have, like last time, we have feedback link attached with quiz. So whoever scored 10 out of 5 questions will get the certificate. So, and while download the certificate, please write your correct name, otherwise you will have a certificate without your name. So these are the technical notes. So now we will move on to the session. So Mr. Muthukumar, please you can continue with your session. All the best. And you can change, and also, yeah. And before, hello, Mr. Muthukumar. Hello.
Shall I start with the session?
Yeah, you can.
Yes.
First of all, I would like to apologize for the inconvenience. Opportunity to share my experience with you. In this today's session, I'm going to cover up my journey. It's going to be a small short story of my experience. and health information management, which will about introduction and of health information management, of health information management. The next skills and jobs of health information management give you an information regarding the graduation degrees and the certifications and the job opportunities around the world. The fourth one will cover LLB-HIM services. What are the services will be offered from LLB group? So can you please move the next slide? So first, let me start with the session with my experience. Today, I'm not going to share all my experience like what I have things because it's going to be a 9-year story. So give me a small brief story because I have started my career in 2010 with episodes prior. But actually, I'm a graduation. I have done my undergraduation and then post-graduation biotechnology. And after that, I searched jobs, but unfortunately, I got job opportunities with low package. Then I came to know the medical coding interviews and the companies through one of my friends. And then I have attended the interview and I got the job opportunity in Episodes Private Limited as a trainee coder. But I have started as a coding professional as a hierarchical control. In that, we have number of specialization like doctors, like how the doctors having a specialization like cardiologist, anesthesiologist, and surgeons. The same way, coding also having a multiple specialization like cardiology coder, surgery coder, multi-specialty coders, and evaluation management coders, hierarchical condition coders. And after 2 years, we came to know that industry, the coding arena and the health information management arena is a vast industry and where we have to equip ourselves in order to stand in the market. So I have a specialty like evaluation management and multi. So I have changed multiple organizations to expand my knowledge in this health information management. So in 2012, I have worked as a hierarchical condition category coder, as a HEC coder in short form. And then I have 2012 to 2015, I have started with Velabet Med Solution. And initially it was named as Sanjay Styles, and it was one of the most famous coding training institute. And later they have started coding company as well, where I have learned multiple specialty surgery, as well as I was working as a medical coding trainer. In this 9 years experience, I have played various roles like junior coder, senior coder, medical coding trainer, and process coach, and senior coder, and information coder. But where I have learned entire end-to-end session is NMC Royal Hospital, which is uh, largest private hospital group in United Arab Emirates, and NMC Royal Hospital is a dream hospital for them, where I have trained more than 500 healthcare staffs, including physicians and nurses and allied healthcare staff. So in this experience, what I have learned is hard work, at the same time to play with smart work. Second thing is country education. We should not stop our learning that we have learned new, empower our skills in this professional. And one, observation and analytical skills. Learn from many people, and then I have very helpful for my ha- this health information management professional. Go ahead with the next slide. Can you please change the slide? Yeah. So the journey is not, it might not be an interesting story, but the next things, the overview and skills, jobs and service, I hope that would be useful for everyone. So this overview, I'm going to cover up introduction and components of health information management. So I hope that you may have the following questions on your head. What is HIM? And second thing, why it is and why it is calling us emerging field. So these questions, this slides, the following slides will give you the answer for these questions. So first I'm going to explain what is health information management. The health information management is referred as HIM. As per IHIMA, health information management is a practice of acquiring, analyzing, protecting digital and traditional medical information vital to provide patient quality care. Practice of acquiring. It means collection of patient health information. So you may ask, what is health information? Patient health information includes medical history, what are the diseases the patient had in the past, and why the patient, what are the current illness the patient is having, what are the surgery he undergone, and what are the treatment received for his past medical illness. All those things will be calling as patient information. So those collect the practice of collecting those information is calling as practice of acquiring, and those collective information noted as digital information. For example, you may receive an radiology report as an in the electronic paper, so that data, raw data, that is patient health information converted as a digital data, and that will be sharing and health information staff in order to provide the healthcare. So that collecting of patient health information that will be analyzed by the healthcare staff like physicians, surgeons, and allied health staffs, and then health information professionals in order to provide health the quality care. You can ask how they will provide the quality care based on the digital data, that patient health information. The live example is COVID-19. Since the COVID-19 have taught many, but for this health information management, this will be 19 will be a simple example to explain. So, university have collected the affected patient data from the world, and that has been shared to the and that has been and based on the data that WHO and then CDC has have built, they have come up with the treatment options and the precaution options, all those things. So the health information data will be useful in this way that the collection of data and all those information will be useful. You can ask how, for example, the patient that initial days where the entire world does not aware about, they didn't aware about what are the treatment options. They have come up with the basic treatment options as as a trial version, and then based on that data what they have received from the entire world, they have designed. Because of that health information management, it's easy to share that health data to one country to another country and one hospital to another hospital in the healthcare profile of patient and what will be the output. So that's that health information management is and is very important for the entire world. And you, yeah, yes, Martin.
No, everything is
And
fine. Yeah, everything is fine. Sometimes we have voice break, but it's okay.
LLM data are used to manage population health. The data which we are going to, the health information data will be used to manage population health. Based on the data will be utilized to prepare the policies, and it will be used to predict the next year cost and healthcare budget for the Ministry of Health, and they will be based on that health, based on the go get with for the new research and all those things. So that health information data will be very 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 useful. At the same time, it will be more effective to enhance the patient care. And the health information and patient the health information data are easy to share one organization to another organization and payer to provider, all those things. That's why this will become an emerging field, and that's why it is giving more job opportunities when compared to other fields. For example, in this COVID situation, many sector employees have lost their job, but the health information management professionals have more job opportunities. At the same time, they have received the payment salary wages on time. This is kind of government jobs, like it will be having an stability. At the same time, it will be having more job security, and it will be more analytic. The jobs is more analytical, more and more knowledge processing job. That's why it will be considered as one emerging field. So I hope now you might understand what is introduction, means what is health information management and why it is important. Now I'm going to explain components of health information management. You can ask what is component. It means the divisions of health information management is one is healthcare payer, another one is healthcare provider, third one is health authorities and regulation bodies, fourth one is information technology. First, I am going to explain what is healthcare payer. Healthcare payer means it's a insurance companies. The organization which will cover up your medical expenses based on the premium, that is called as healthcare payer. They will come up, for example, insurance in India and national insurance in USA, Center for CM, like Medicare and Medicaid. Like, I hope you may have an idea about health insurance companies, various health insurance companies. Those companies will be called as healthcare payer. The next one is provider. The payer means, and payer means the name itself you might understood what is payer. The next one is healthcare provider. The the sector or the people who will deliver the patient care, that will be called as healthcare provider. For Ms. Abhinay, can you please go to the next slide so that participants can easily understand that concept?
Yeah, I changed the slide. Can you see?
No, actually it is same slide, which we are seeing the same slides. Yeah, payer means it's a healthcare insurance and Ministry of Public Health. And second one is healthcare providers, which will falls under like hospitals, long-term care facilities, nursing care facilities, ambulatory care center, medical center, clinic, and primary care center, and public health and research center. Healthcare provider means that hospitals and other facilities human, which will provide the, which will take care of the patient, public health, that will be considered as healthcare provider. And then regulation bodies, health authorities, and authorized auditing body. In India, it is a Ministry of Health, or Ministry of Health, and in USA it's CDC. All those things will be considered health authority. And authorized auditing body, those who's already who's in that health information professional like medical coders or health insurance people, they will understand who's auditing body. So that I'm not going to explain because it might confuse. After at the end of the session, I'm going to explain what is authorized auditing body so that it will be easy to understand. And the next one is IT service. IT service in the sense the software, because the health information data should be converted as electronical data. For that, we need a special softwares and health information tools. That solution will be provided by the software team and web developers, and network and computer system administrators, and computer programs and data administrators. These five, like payer and regulation bodies and healthcare provider, IT service, these four things are the components of health information management. That's why this field is having more job opportunities than other fields. So now I hope you might understood what is health information management and what are the components and why it is important. So now you may have the questions like how I can, if I want to pursue or I want to become an health information professional, what are the graduation or degrees are available in the market, and what are the studies which will give direct entry to the health information arena, and what are the certifications will give you the get entry to the health information management. Those things will be in your mind. So in these questions like who can become health information professional? So first thing, simply we can say that medical students and nursing and paramedical and allied health and life science students. So uh, in this medical MBBS and MD, BDS, so likewise etc. There are falls under medical professionals, and in the upcoming slides I will explain for kind of profession, which kind of position, what kind of graduation or what kind of degrees are mandatory or most probably the profession, what kind of graduation holders the companies will give you the priority. Paramedical and those, I think, hopefully you can understand by seeing the slide itself. So I'm not going to give much explain on this. So who can become health information professionals like medical students, paramedical and allied health and nursing? Next slide, because you, and yeah, I have complete. Previous, yeah,
Yeah.
you can stay on the slides. So in this, most of the people will have an idea. It's a health information which is related to healthcare sector. So you might not, you might guess that nursing and paramedical students are eligible, but some few management graduate courses and degrees will give you direct entry for this health information management professional and jobs. For example, that is healthcare management and healthcare administration and hospital management, and finance analysis course also will give you finance analysis courses like BBA hospital administration or MBA hospital administration or BSc hospital science, MSc hospital science, like, or become students if they are going to pursue for any coding or health information professional certificate, they can become an health information professional. And then next, even IT jobs, because IT solutions will be provided by the IT sector people. That's why that B and B.Tech and M.Tech and MCA people can provide the IT software professional solution. So these five field people can enter into the health information professional. So I hope you have an complete idea like what is such health information management and who can become the next. This over we have cover up all those things. The next slides like skills and jobs will give you a complete information about what are the graduations and what are the professional certificates we can pursue to become a healthcare professionals. Yes. So in this health skills and jobs, we are going to cover up the available degrees and doctorate courses for to become an healthcare information professionals and what are the job opportunities available and where it is available and what kind of profile name and what are the migration opportunities. All those things will be covered up in this skills and jobs. So explain what are the degrees are available to become an healthcare professional. I'm going to classify as three types. Direct entry, it means they can directly pursue the health management courses and then they become a healthcare information professional. And the second one, we management professional when we choose our graduate. So, but still we can switch to our professional. For that, there are certifications are available. Those things will be explained in the session. And then third one is what are the job opportunities, and for that, what are the criteria, and what are the migration opportunities. So the first I'm going to explain the direct entry. The direct entry means what are the health information courses are available. The first one is healthcare administration, and second one is hospital management, and third one is health information management, health science, health informatics, and and medical law. Whoever is going to pursue any bachelor degree or master degree or doctorate from these categories, they can directly enter into the health information management profession and they can reach the higher positions like managers, directors. And the next one is, can you please
Can you see
the
it?
upcoming slides? Yeah, I can see. This is for who want to who become healthcare professional but in a different career path, like nursing, but they want to become a health staff. They can choose these uh, sessions and they become a health information professional. So first one is when it comes to an higher education, the Western countries are having high standard and more value than the developing countries from the Asian countries. First thing, the more health information courses are from USA. The first one is American Health Information Management association, and it will the URL name, and you can click the URL name, and after session we will share the PDF so that you can uh, take reference of this site and you can directly visit the site. You will have n number of certificates for different categories based on your qualification. You can choose one and you can research about it, and then you can empower your skill on this health information management. And AHIMA certifications are in the health information management. And you are having certifications in the following categories, like because since it's an introduction class, I'm not going to cover up many things. So I'm going to do only the basic things. That's why I'm not explaining many things. Maybe if you have all those queries on the technical, you can answer all the questions in the end of the session. So in the AHIMA, applications are following categories. One is coding, and second one is documentation, and third one is finance and IT solutions. And if you are going to pursue one of the certification, any one of the certification from this organization, you will be eligible to work almost for the world. One is American Academy of Professional Coder, AAPC, and it is one of the most US coders, certified coders have professional. And the same way, you can click the URL and you can go and search. You will be having n number of certifications and you can choose one of those certifications. Next one is Association of Clinical Documentation and ACIS, and this is one of the most prestigious certificates, and these need special qualification to pursue these certificates only from medical students or the person who's already experience on health information management. They can pursue this clinical documentation certificate, and you can check for more information. And next one is America's health insurance plans, because what we have, the first three organizations are healthcare regulatory bodies. They will design the regulations and they will give you the more data regarding regulation and policy and rules, and then health information related information. But America's insurance plans, it is specifically for insurance companies. When you are going to pursue this insurances certifications, you can able to or in the health insurance payer side or health side. So from the USA, these are the most this the those four organizations, most popular organizations which will provide USA healthcare sector related certifications. Next one is United Kingdom. For this healthcare information certifications, each and every country is having different rules and regulations and policies. That's why every country is having their own different coding at the same time health information certifications. if you want to become a health information professional in UK, you have to pursue the certification from IHIM, Institute of Health Records and Information Management. And when you pursue certification from this organization, you are eligible to work in the UK and NHS. Please go to the next slide.
Yeah, can you?
Yes. The next one is Canada, and then Australia and New Zealand. These two courses are more certifications are most at the same time it is more prestigious certificates for healthcare sector. From the Canada Healthcare Board is when you are going China, Canadian Health Information Management, also you are eligible in Canada. Life Office Management Association, and it will give you the n number of certifications in the following categories like coding, insurance companies, and insurance policies development. You can visit the URL and you can visit all the and you can do. These two organizations are most popular in Canada. And the next one is Australia. So Australian Health and New Zealand Healthcare Board is when you are going to pursue healthcare coding certifications or health information certifications from the following category, you are eligible to work almost 15 countries. New Zealand, Hong Kong, and Arab countries like Saudi Arabia, Bahrain, Qatar, except United Arab Emirates, all countries are following Australian coding system. There, if you are when you are going to pursue coding certifications from one of these organizations, either from HIMA or TOEFL, WATAN, then you are eligible to work in these countries. And for HIMA and Australian coding, you have almost nations, and every countries are following different versions. So before going to choose the certifications, you first make sure that which country you are going to work or which is your dream country where you want to work. Based on that, you can choose and then you can pursue the certifications. And this is one of the most expensive certificates, and most of the certificates are having 2 years period, and it is an all these certifications you can pursue through online. Can you please move the next slide?
Yeah, can you say?
Okay, so now we have covered all the skill sets, like how we have to empower our skill set and what are the what are the degrees or what are the certifications available in the market. Hopefully, you might have a clarity that once you go through all these URLs, you will have an insight and you will have entire knowledge regarding the certifications and what will be the requirements in order to pursue those certifications. Once you have the certifications, what are the job opportunities? That will be our the next questions on our mind. So now I'm going to explain what are the job opportunities are available. So before I'm going to explain, I'm going to classify the jobs in three category. One is acute care facility. It means it is belongs to the hospital. It means it going to be in a provider side. The second one is payer side, and third one is corporate. You can ask what is corporate? Corporate in the sense in United States, most of the health information jobs, almost 80% of the jobs are getting outsourced to India and Philippines. So most of the private organization that corporate companies are having the jobs, and so they are having the different organization structures, and they are having the requirement criterias are different. That's why I'm going to classify as three. One is acute care facility. It is going to where you are going to work in the hospital sector or clinical sector as a direct employee. The second one is payer side. You will be working in the insurance side. And the third one is corporate sector. When you are working in India and Philippines, you will be following under corporate sector. So first I am going to explain us acute care facility. So in that acute care facility, we are having a sector called or division is called as revenue cycle management. The cover up from the patient once he enter into the hospital and after and how we are going to collect a reimburse from the parent. For those, all those things will be comes under revenue cycle management. For example, in India, assume you are going to the hospital for treatment for your illness, and you may receive the, you may enter into the hospital, and you will directly you will go to the front office, and you will check the availability of physician, and you will choose your favorite physician, or you will choose the available physician to treat your illness, and then you receive the treatment from the physician, and then you will directly pay the appropriate payment in the front office itself. That's it in India and other developing countries. It is quite different in well-developed countries. Or they are following health information management protocol, then it is going to be quite different. Even a small how the developing country or health information sectors structure be. The first one is front office executives. Front office executives and receiving patients, and forward patient they will forward the patient to the appropriate the care areas. And the next one is healthcare provider, that is physician and the nursing people. They will provide the or they will render the service based on the patient need or based on the patient illness. Fourth one is that collective health health information, the healthcare information will be converted as chronicle data or information data using healthcare tools that will be analyzed by the management staff like medical coders, will be medical coders and billers. There is a category that I'm going to explain now. The patient received, the front office will receive the patient, and they will forward the patient based on their patient need, and the fourth one is that rendered service will be converted as numeric, and that will be converted as numerical or electronical data, then that will be analyzed and that will be converted as numerical, then that will be claimed. Means simply we can say that one in developing countries, once you receive the treatment, you can leave the hospital, and the hospital duty is to receive the to retrieve or to get the payment from the insurance side. For that, that OCM or the health information professionals will follow the standard protocols, all those things. That will be a different story. So in this basic session, if you are going to look all those things, that will extend, so that I'm going to give only the name of the profiling, the front office executive and front office executive supervisor. You will be having a hierarchy like senior, executive, supervisor, manager, and then ward clerk. Their responsibility is to enter the data, whatever the service is rendered, that information will be provided to the ward clerk. Any kind of graduation holders can work as ward clerk, front office executives, and if you have certifications from health information bodies, then having more more growing up. If you are having 1 year degree graduation, you may get job opportunities, but it will be you might not have the overview or the clear picture how the organization is working. Why? So the third one is pre-authorization or insurance approval officer for certain procedure. For example, the patient is going to have MRI or CT. The procedures are expensive, so we have to address to the insurance from the hospital side or the payer side. They have to address to the insurance side that one of your client have received a hospital that we are going to perform this procedure for this illness. For those things, those information we have to transfer to the or we have to address to the insurance team. Those kind of professionals will be called as pre-authorization officer or insurance officers. For this designation in developing countries, most of the time they are giving more priority to the clinical staff like doctors, pitta, homeopathy, and Ayurvedic, naturopathies, and nurses, and any allied healthcare staffs. And apart from that, if any healthcare staffs who is having hands-on experience at the same time, if they have if they have recognized coding or recognized health information certifications from any bodies, then they can play as a pre-authorization or insurance officer. And you will be in a hierarchy like junior, senior, supervisor, and team lead. And the next one is medical coder. That information, for example, that medical terminologies or the medical services will be converted as numeric, standard numeric. That will be called, that is, that those professionals will be called as medical coder. For example, most familiar disease name is hypertension. For that, that coding is the standard code is I. So we have a certain digit of codes that will the WHO, World Health Organization, have designed, have classified the disease and the procedure with the standard numerics. So that will be those things for each and every diagnosis will be having, or each and every procedures will be having a different digit or different code to describe that particular procedure. For example, hypertension we will be calling as I10. And the same way for procedure for suturing we'll be having certain series of codes. Those kind of professionals will be called as medical coder and clinical coders. These professionals are most demand at the same time highly paid professionals among health information management professionals, and those coders will be classified as, again, they are having n number of specialized certifications, like specialized coders like doctors like cardiology doctor and urology. The same way coders also will be having a specialization. You can pursue you can pursue the specialized coding certification to become an specialized coders. The same way you will be having an hierarchical categories like hierarchy, like junior, senior, and then specialized coder, and then technical coders, and supervisor, team leaders, managers. And the next one is clinical documentation. The documentation specialist will train the physician and allied healthcare staff how to document. For example, in India, if you go to the hospital, you will see only the drug's name or prescription. It's hardly you can see the disease name and the treatment options. But in developing countries, it should be there is a protocol how to write and what are the components are mandatory. What are the components are mandatory. So those kind of information will be given by the clinical documentation specialist, and those the clinical documentation specialist most probably can be a medical professionals or clinical professionals, or if any coding professionals who is having hands-on experience, they can become clinical documentation specialist. And clinical documentation specialist are one of the most highly paid specialists among health information professionals. And case manager, most probably case manager will be any one of medical degree holder like PBS or PDS or any doctors. And if you are having hands-on experience on different specialization of coding, and if you have end-to-end knowledge on health information management, if you have appropriate coding health information certifications, you can become case manager. Then RCM manager or RCM director, the entire hospital revenue will be managed by the particular person. It is one of the highly paid profession in the health information management. And call center, it is again, it's kind of BDO service. Anyone can get into this field. And if they have again health information knowledge, they have a great opportunities to grow in this acute care facility side. I hope that you may have little bit knowledge regarding this. What are the profiles? How the profile name? What are the profile names you have to search when you are trying to get the jobs in medical coding or health information management? The same way you will be having an. Can you please move to the next slide so that I can.
Yeah, can you able to see? Yeah.
Noted. Can you please move on? Yeah, now fine. So next again we will be having all these kind of professions like medical billers, uh, AR callers, denial management, and data analyst, medical records officers, and medical transcriptionist, and clinical application specialist, and IT supervisor, web developers, all these kinds. When you are going to be in the hospital, almost and every hospital will have minimum of 100 to 300 employees based on this profile names. So you may have a clear vision regarding the acute care facility job opportunities when you going to pursue the health information job. Can you please move the next slide?
Yeah.
Yeah. In a corporate, and it is moreover it is going to be only in India and Philippines. In India and Philippines, when you are going to work health information professional, you may have job opportunities in the following profiles name, and having more than 1 lakh job opportunities in India, and every day and every years the number of new organizations are coming, and they are they are creating more opportunities. When I started 2010, we had only few companies, but now we are having more than hundreds of organizations offering job opportunities in the following categories. For that, you need to be a coding professional, or some organizations are offering direct training courses for the health information management, and the company itself will provide training, and they will hire you, and they will pay you for that based on um, their corporate policy. So the same to health information management, simply say the profile name is coder, biller, auditor, and then clinical documentation specialist, case manager, and then office, and biller. So it's maybe it is initially it will be hard to remember all those names. When you are going to go through all those things, you will have a side. But in the insurance side, you will be having a different profile name, like only you will be having a coding. Can you please move the next slide so that they will be having a clear picture? Uh, that's fine. So the same way, like insurance sites also the same way, you will be having pre-authorization approval officers and medical coders and recovery auditor, like that. All the same profile name will be there, and the same qualifications you need. When you want to become, when you want to work in the healthcare fair, and you need to pursue any one of the billing any one of the billing certification, that will show you as unique person in the field, and it will bring you the more opportunities. And the next one is in India, like developing countries, when we are going to pursue any degrees, first thing, what we are what is what we will see, what are the foreign opportunities, how I can enter into Europe, or how I can enter into USA, Canada, all those things. The clinical staff, health information professionals, are one of the highly skilled professionals, and my most of the countries are welcoming health information professional in the following category. For example, in Canada, you can see there is a code like each and every there when you have a clear picture to have a migration list or how to search in the migration. I hope if first I will let you know what is migration. In India, we are a citizen, we can work anywhere in the country. But if you want to work in any other country, either we must hold the citizenship or we need to get a work permit. For that we have to either we must have one job offer from the employer, or you must have a citizenship or permanent residency. Then only you can able to work in other countries. For those kind of for from one country to another country, when you are migrating for the purpose of earning purpose, then you will be considered as migration people. When you are having highly professional degrees, then each and every countries are categorized based on the professional. They are classifying and they are giving priority based on their need. In the same way, Canada is having a health information management professional in the skilled migration list. When you have hands-on experience, you are eligible to apply for permanent residency. And once you receive a permanent residency and are eligible to work anywhere in Canada. And in Australia, you are eligible to work in clinical coder in only in few areas. Like we can say, um, some state will give you the work permit. Some state will not give you work permit. But I will give you a clear picture how you can migrate to Canada. When you are a healthcare provider, when you are health information professional, first I am going to give you a step-by-step information. When you are a student and when you are going to pursue health information degree, you will get direct permanent residency in Canada. And after your degree completion, you may have you may have job opportunities, or else you will be having a grace period to work in the particular country to gain the experience on the same field. So when you're going as a student, when you are passing, you will be directly eligible to work. And second thing, most of the time, most of the Indian or Asian continent medical staffs when they are trying to get into the Canada or USA, it is hard because the exam from the health authority of Canada and USA is very tough. So possibly 50% of people will get negative result. So they will give more attempt in order to get into the countries to become a healthcare employer. So sometimes they will give up. Few people will not give up. They will keep on trying, and finally they will get. But this is another opportunity. This is another gateway to get into the Canada. If you are going to pursue one of these certificates from the if you pursue directly, you can enter. If you are having a partner or your family members are working in Canada, if you are if you are pursuing this certification when you are residing in Canada, you will be getting jobs and you are having enough job opportunities in Canada. The same way in Australia also, you will be having highly paid and approximately you will be getting for annually $40,000 to 120 means $1,20,000 per annual. Australia is one of the highly paid countries among the world, and at the same time, you are having n number of opportunities. But if you are going to be a student, you will get job opportunities. But if you are going to trying to get the immigration, it is not easy as saying that we have applied. You have to wait patiently and you have to research a lot and you have to get more information, and most probably 90 90% of the people will approach the consultancy, but that consultancy people will not give much information. So before going to pay for the consultancy for a migration list or anything, you have to research at least 6 months and try to connect with a local who is residing in the particular region. Then you will have more information so that you will not lose money, or else the migration is, you will be having opportunities, but number of people, n number of people will apply at the same time. So you have to, you may have to wait for longer time. So before going to apply, you have to research a lot and may and empower yourself, and then you try to approach all those things, and you will get the better opportunities in the all these countries. And United States, you can ask whether we are having migration opportunities in USA or Europe. In USA, 80% of the jobs are outsourcing to India and Philippines, hence it is not falls under migration list. But if your partner or family members are in USA and if you have opportunity to migrate to USA, then if you are going through, if you are going to switch into health information management sector, you will be having vast opportunities and you will be having more and more opportunities in USA. The same way in Europe also, each and every countries are having different health versions and they are having different certifications. But in Europe, there is a, the country needs that regional language. You should be familiar with the regional language. For example, in Germany, you need to learn the German, and the same in France. You have, if you want to migrate to France, you need to learn the French, and then you have, if you are having, if you are going to pass all those certifications, you will be having opportunity to work in healthcare sector. I hope that people will have a clear picture regarding the job opportunities and then demands of healthcare information professionals, and what are, how we have to migrate or migrate to the other countries. In order to migrate, what kind of um, certificates we have to read, what are the groundwork we need to work. Can you please move the next slide?
Can you see?
Yeah. So far we have covered overview of health information management. In overview, we have covered what is health information management, and second thing, why it is calling as emerging field and uh, why it is very important and why it is having more opportunities than other industry. And then what are the components? Then the second, skills and jobs, we have covered what are the graduates degrees are available and what are the job opportunities, and what are the countries are offering migration facility or migration opportunities to migration opportunity to migrate to the particular country. So now I'm going to explain the pros and cons of health information professional. First, I'll give you the positive side. Health information professionals will have better opportunity to earn. They will have a more highly wages, and they will be having high demand and the job security and stable. But this is going to be a knowledge process work. Hence, you have to keep on update yourself by learning the courses, by learning the updates of the health information management. The negative side of this health information management is due to the prolonged sitting, because you are going to sit in front of the system and you are going to work, and so it might affect your health, and it may lead to obesity or some other back issues. Apart from that, it is one of the best professionals for the current situation, at the same time for the current generations. And for the people who is residing in the countries like Western countries or European, any kind of degree if they hold, they can pursue, they can become healthcare professional, and if they wish to work in healthcare sector, they can pursue and they can work. Even they can be either they can be a doctor, they can nurse, or any normal degree like anything like BCom, MCom, whatever it is, they can pursue and they can keep on learning the new things, and they can reach the higher level in that particular hospital or insurance side. Please move the next slide so that we can.
Yeah, can you say?
Yeah. So we have covered over. We are in the session end. In this, we are going to give you what are the services we are going to provide from LLB-HIM and why we have started this LLB-HIM. First thing, I have been worked in different countries like India, and I have worked in various states like Chennai, Bangalore, and Delhi, and then in United Arab Emirates, Abu Dhabi, Dubai, Alain, and I have worked in all the Emirates almost, and then I have visited Qatar for looking for the opportunities, and then Singapore. And what I have across, most of the consultants or consultancies are giving the advertisement like that you are having the opportunity, earning opportunity, migration list when you are a healthcare professionals. But honestly, it's not true. Whatever the emails you are going to receive, you do not trust them and do not pay until you receive the job, because the process is too lengthy, and it is where most of the consultancy people are not aware about what is health information management, and they cannot guide you properly. Only few consultants are offering better guidance. They are not collecting any money, they are only placing the people. Likewise, in India, it is very working. It is placing the people in Qatar, other Emirates for the healthcare sector, especially for medical coding. The for my I need to say is, do not trust the consultants or consultancy when you go for abroad. Connect with your friend circle and research, and then you can proper guidance rather than blindly trusting the consultancy people. So first, we have created this LLP HIM to give a insight of health information management and job opportunities and awareness of health information for the student society. And second is to provide or to share our experience and knowledge to the student society, at the same to the health information management professional. And third one is it will be a platform for students, health information management professional, healthcare payer and providers. So we will try to provide all kind of training for the students and for the professionals, and we will try to create an environment to connect the experts, healthcare experts from any kind of background. So by seeing the slide itself, you will understand what kind of service we are providing. And please, before trying to get into the health information management profession, try to research more, try to get more data, and then you decide whether you have to pursue health information management profession or. But in health information management will provide the either you can choose as your career path, or you can use this as a tool to achieve your dream. For example, in India, health information professional, for example, health medical coders are getting packages, salary packages equal to software developers. Like their salary is varying from 20,000 to up to 1,20,000 per month. So it just depends on the experience and specialization and your profile. And thanks for giving the opportunity. And thanks for the participants for the patience. And if you have any questions, you can shoot out, and we will try to clarify.
Yeah.
Yeah.
Thank you.
Hello. Thank you so
Yes,
much,
doctor.
Mr. Muthukumar Velusamy. Actually, we have received many questions, but since we have running out of time, we are going to take only few questions, and the questions will be addressed by Ms. Abhinaya. So, Ms. Abhinaya, you can carry out with your questions. Yeah, thank you.
Okay. First question is, what will be the for him in India?
Yeah. In India, health information purposes most of the time this belongs to corporate. So the designations you are having n number of profiles, and most common profile is medical coder. For medical coders, you are having specialization like doctors. So based on your specialization, your salary will be varied, and based on your experience. For starting people, you can expect from 12 to 18, and for
Okay.
coders, you can expect up to 30K. And for more than 2 years, people based on your specialty and the certificates which you are holding and the company policies, you can expect more than 30 to up to 60K, means 60,000 per month. Usually it will be 3.
Hello.
I hope you can. I hope.
Yeah. Thank you.
Okay. So shall I repeat myself?
Yes, you can say it again.
Or
No,
yeah.
Mr. Muthukumar,
For
sorry for
fresher.
interrupting. Actually, that was okay. So it's understandable.
Okay. Then we'll move on to the second question. So, can you differentiate between medical coding, medical writing, and the health information field? Because most of the people are confused with the names.
Some medical coding. It's a coding in the sense medical terminologies like disease name, procedure. Disease name in hypertension or diabetes mellitus or um, asthma or epilepsy. These will be calling as medical terminology or diseases. The same procedures like injection or suture or any kind of surgery will be called as procedure. So the diagnostics and procedures will be converted as numerical, that is called as medical coding. That each and every numerics will have certain value based on the country. On the country. For example, you say for you the in UAE it might be $60. So it depends. So medical coding is converting the disease and procedure as numerical. That is called as medical coding. And revenue cycle management, that converted numerical will be sent forward to company and based on that they will receive that revenue flow will be managed by the healthcare professional staff with a different profile name like medical coder, biller, um, AR calling, and then documentation specialist like that different. The medical writing, it is coming under as a kind of data work. It could be anything. It might be a scientific research data, or it could be any other research data. They will be writing the content. So for those professionals, what they need is they need advanced English or advanced business language skill. They don't need any kind of medical science or they no need to learn anything related to insurance or they no need to learn anything related to disease or procedures. This is a major difference.
Okay.
So
So,
we have yeah, yeah.
so we'll go to the next question. So, is it true that HIM certifications are very expensive? And another thing with that, is there any center in India that is providing free and reliable free courses for HIM?
In India, for graduation degree, the same way universities are offering and you can directly pursue. For
Okay.
certifications, we are having the healthcare professionals are training the students or entry level people for international certifications. India doesn't have any kind of coding certification. The
So in
Indian
India,
doctors, yeah, are having n number of trainings.
okay.
In the skills, I have showed a few certifications like ASHA, A, LOMA, HIMA, SHIMA, like that. Can you show that PPT so that the people will understand what is the difference? Please go to the skills and jobs.
Just the slide you want to see.
Yeah, these are the healthcare organizations which will provide certifications and If you are going to pursue from Canada, you have to pay from Canadian dollar. If you are pursuing Australian certification, you have to pay through Australian certification. So what I will suggest, if you are going to pursue Australia or New Zealand healthcare bodies, in India training institutes are there. One training institute which will guide you and for these certification, and they will charge you for the tuition fees. Audible?
Yes, yes.
Yeah, the same way you can go to the previous one, the AAPC,
Yeah.
means USA certificate.
Yeah,
The
can you
previous
see
one,
it?
USA certificates. If you are going to pursue one of the certification from USA certifications, we are having training institutes in India like LLB-HIM, experienced professionals. We can teach you and we can guide you in order to pursue the certification. And we will guide you how to pick the course and what are the materials you have to go through and how to register the exam and when you have to book the slot and how to achieve the exam and how to pass the exam. That's it. But we are not providing any international recognized certifications. Only we are training, for that they are charging the training cost.
Okay.
That's it. Is it clear?
Yeah, yeah, it's clear. Okay.
Yeah.
Timing is running out. We are ending the session right now, but you don't have to worry. You can post or for all the questions we got from the session. We'll be replying through our Telegram group. And if you still have any questions, you can ask us through the Telegram. We will reply through the Telegram. Thank you so much, Kumar, for your wonderful sections. We gained a lot of information from this section. Hope it's been helpful for these students that people are looking for the career in HRM. Thank you so much.
Thank you so much for all the participants and LLP members.
So thank you so much, Ms. Abhinaya and Mr. Muthukumar, for answering all the session and keeping the session very interactive. So thank you so much. And all the participants, we have shared the feedback link in the chat box. So please go through it, and the feedback link will be open in few minutes. Yeah. If you have any questions, kindly post it in our Telegram group, and stay tuned in our Telegram for the training programs. Thank you so much.